Good morning. I'm Trent Haywood, and so I'm going to talk a little bit, just a few remarks about the infrastructure, as you will, in terms of the value related to the research practice. And I was excited when Sarah and Joe asked me to talk a little bit about that integration between research and practice, because it harkened me back to my years as a boy in Oklahoma when I was in my mother's kitchen, and I often found myself simultaneously doing research and practice. In fact, I thought my claim to fame was going to be the one that innovated the best grilled cheese sandwich when I saw how long it took my mother to actually make her grilled cheese sandwiches. And I saw the toaster sitting over there unused. And I thought, wouldn't that be a great combination to be able to use that toaster to make grilled cheese sandwiches? Needless to say, that research didn't work out too well, and so my mother forbade me from using the toaster for quite some time. In that same particular kitchen, I also noticed that there happened to be back then with the refrigerator we had, that we had the freezer coils. And so I was very curious about some research about how do these things really work. And so being a young guy, I decided the best way to figure that out was to taste it. Put your tongue on that freezer coil and you'll figure out how it actually works. So needless to say, I ended up putting my tongue on the freezer coil, and I figured out that one thing that it does is that if you're not cautious and really lubricate that tongue, it will actually get stuck on that freezer coil. So, of course, I had that little scar on my tongue, but here's the interesting part about that relates to today's conversation. Now I had knowledge. I had some knowledge, and if I have knowledge, the question that becomes important is, well, where's the location where that knowledge is most valued? And so as a young person, as you can imagine, in that particular environment, the place where you're going to really look for that knowledge market, that location, for young boys like me, is the playground. Very clear. It's not confusion at all where the location for knowledge occurs. You go to the playground. If you have great knowledge that you want to share while school is in session, you get together on that playground and you come forth, and that's the knowledge market that's unfolding. So that's one component that we'll talk a little bit about, which is being very clear about the location of the knowledge and being able to decrease search costs. Because if we're not clear about where the market is and the location of that market, it is very difficult to talk about sustaining any type of learning environment where the market is constantly moving its location. So I have my story about this freezer coil. And so I took it to the playground. And of course, my peers are always gathered there. And so one of the second things that's very important about sustaining something like this is, okay, now that you have this particular market and you have this particular location, it has the right people in place, so it has your peer group that you really want to exchange knowledge with, you need market signals. You need market signals. Okay, if this knowledge is going to actually be exchanged, I need to understand the quality. I need to understand something about the satisfaction of it. And then ultimately, I need to understand the cost. So how does that play out on the playground? Well, the way that we did it back then in Oklahoma in the early 70s, if you really have a quality story, the only way we figured that out as boys is you had to put forth your scars. If you didn't have a scar, it was poor quality story. We didn't even want to hear about it. You don't have the scar to prove it, right? But I had that juicy scar on my tongue, right? So I was able to verify right up front, let me tell you the quality of the story I'm about to tell you, right? So I stick out my tongue, everybody gets grossed out, now they're interested. Very clear quality market signal, right? The second portion, of course, is the satisfaction portion, which is as soon as you stick out your tongue and they go, wow, ooh, that's gross, they're satisfied. Right? These young boys are really satisfied. Now the only question is the cost for this particular story, which is social capital in that setting, which is, okay, as I tell this story, what is the risk in telling this story, right? What's going to be the risk to my particular brand in that particular school for that particular time? If I tell a horrible story around this particular scar, I lose social capital. If I tell a great story, I gain social capital, right? So pretty straightforward. That's the cost or the risk involved with actually this. And then finally, it's closing the deal, which is the transaction portion, which is how do we actually close the deal? In that particular setting, it was, again, pretty straightforward. You knew roughly about the attention span of your peers, and you knew about how long recess took, right? So whatever story you're telling, if the bell goes off, you just lost it, right? You didn't close the particular deal. And so that's very important as we're thinking about sustaining the environment. This is really, to me, you're looking at this from a knowledge market standpoint. Some of you have looked at knowledge markets and thought about it from a market economy-based perspective. You have to get clarity at least on those three components in terms of a knowledge market, where's the location in which this market is going to occur, because that decreases the search cost for everybody if you're bringing these people together, the knowledge seekers and the knowledge providers in that particular environment. And then what are the clear signals? So we're talking about this learning environment. How do I know one place is better than the other? What's my clear signal about that, right? What's the quality? What's the satisfaction I'm going to get out of? I saw some earlier slides about that return on that particular investment. What are those market signals that we're all in agreement with? And then finally, how do you actually close that transaction? And so people are on different sides of this portion as to how you actually are looking at this. Some look at this as a public good, and some look at it as more of a commodity. Very different fundamental ways in which you might structure that, as you can imagine. If it's a public good, then we're talking about all of us playing into it, that it's not necessarily exclusive, and it's not rivalrous at all, that everyone has access into it, right? That's one model. Fundamentally different is a model in an environment in which we find ourselves in a value-based payment environment where you might actually be competing on this knowledge, whether you want to admit that or not. So I saw Patrick in here earlier with Medicare stars and things of that nature. Some of my peers are here in this room where we actually have businesses and providers that probably compete about their quality, whether they want to do it in terms of marketing, whether they want to do it in terms of the actual financial incentives that are associated with that. So how does that actually play out? If I'm actually competing with you and then you turn around and want me to give it away as if it's a public good, that seems problematic. And so I don't think we're necessarily clear about when we're talking about this knowledge as being a public good and when we're talking about this knowledge as a private commodity where people are actually setting up infrastructure in place for financial incentives for people to actually compete in that particular setting. It was one of the things that we originally had some concerns, even from my CMS days to my VHA days to Blue Cross and Blue Shield days now, which is to say, one of the things I always did admire about the Malcolm Baldrige Award was that it was designed to not only give you social capital, but as part of that commitment, you were supposed to share your knowledge, right? So that it didn't give you an incentive to necessarily hoard knowledge, that it actually created an infrastructure where knowledge hoarding wasn't acceptable. I'm not so certain that we've tackled that just yet here. And so as we're thinking about some of the things that we have to tackle in terms of sustaining this in a learning environment, one of the questions I do think we have to answer is this knowledge hoarding question about how do you actually structure this in such a way that it doesn't lead to knowledge hoarding, right? So that we can be able to do that. A few last comments here before we open up it for the panel. In my current capacity, this happens all the time in terms of people asking questions about, as it relates to research and translating that into practice, whether or not payers are going to start to actually pay for some of that. So Rita was kind enough to talk about one of those places where it comes up in terms of our medical advisory panel where we're making technology assessments, things of that nature. And we often need that research to be able to make fundamental decisions about what might be beneficial to our patients. And so the question ends up arising, well, since this is going to have downstream benefits for your membership, should you also invest on the front end? You know, and we don't have a full answer. You know, to be honest, as we stand here today, we don't have a full answer on that because we know we're not satisfied with some of the research that we get, that we think that there does need to be research on the other side, and so we're looking for opportunities to be able to do that. On the other hand, we know that we're also going to be the ones that's trying to evaluate that research on the back end. And so now you're setting up potential conflicts of interest, at least in our shop, in the way that we think about the traditional model. So we're unclear about some of that. In terms of the realm where I was talking earlier about value-based payments, we definitely want to be supportive of that with providers and being able to drive value across the board. The issue ends up being the things that I talked about in that playground situation is, but how do we do that in a way that we really can link it to the best market signal so that we really can disseminate that in the most effective manner? And part of my team, that Center for Clinical Practice, that's what they spend their time doing. Working across all of our individual plans, our 37 plans across the board, quickly trying to identify leading practices that somehow have some measure of validation so that we can say, okay, this meets some type of market signal level that we're satisfied with, and then quickly trying to disseminate that. Now, the reason why that works in that particular environment is because it's a system environment, right? So in that particular environment, people are willing to share a little bit. But in an open competitive environment, I don't know if that would really be necessarily the case. So I look forward to the dialogue and discussion. So thanks for having me.